Hello, this is Dr. Ford Brewer with PrevMed, Preventive Medicine, heart attack, stroke, cancer, diabetes prevention. We did a video recently on Ghrelin, the hunger hormone, the only known hormone to create an immediate sensation of hunger. We were just learning about these hormones that do this over the past decade or so, and it's abysmal, despite how much information and research we're generating, how little we still know. So again, ghrelin is secreted by an empty stomach. Once you eat and you stretch that stomach out, the ghrelin hormone stops being secreted. We mentioned PYY. It's down in the lower intestines. Once food gets down there and the digestion starts in the lower intestines, they create a satiety response. In other words, they make you feel like I am satiated. I'm not hungry anymore. We talked about a couple of other hormones, but what are we talking about today? We're talking about ghrelin in terms of diabetes and insulin. Diabetes treatment research. Now that is an interesting twist. I first noticed it from a headline regarding this team in University of Texas. This doc right here has been doing research implicating glucagon in insulin treatment, and then ghrelin came up as well. Now, what's that all about? Well, first let's understand insulin, glucagon, and ghrelin and how they interact. First, insulin and glucagon. That's what we've known about for a while. Both insulin and glucagon are secreted by the pancreas. Insulin decreases glucose in the blood, and glucagon increases glucose in the blood. Insulin causes the liver to stop making glucose. It causes the liver to start pulling glucose in and making glycogen, which is the storage form of glucose. It causes the muscle cells to take in glucose as well, and all of this causing a decrease in the blood glucose. Well, what if the blood glucose is too low? Well, then the body comes back, the pancreas notices that and says, oh, wait a minute, let's secrete glucagon. Glucagon causes that pancreas to take that glycogen, or stored glucose, and release it as glucose in the blood. So glycogen increases. Glycogen breakdown in the liver increases blood glucose. That is stimulated by glucagon. So what you begin to see is that the hunger hormone, which we'll mention in just a minute, impacts this mechanism for controlling blood glucose. Blood glucose is the issue around diabetes, and we've got a constant balance between insulin and glucagon in terms of insulin dropping that glucose when it gets too high and glucagon increasing it when it gets too low. So let's talk about ghrelin for just a second. Ghrelin has the more we study it, the more impact we're finding that it has. But for this video's discussion, here's the impact. Well, again, just to remember, ghrelin is the one hormone that we know that immediately causes hunger, makes us want to eat. It has impact on things like it decreases inflammation, it decreases cell death of the lining of the gut. In other words, it prepares the gut and says, guys, we got to eat. But here's the interesting thing. It increases gluconeogenesis. In other words, it increases the same function that you get with glucagon. It raises the blood sugar. Now, why is that important in the treatment of diabetes? Well, think back on what we've got in terms of diabetes treatment so far. Up until recently, just a few years ago, all we had were like the biguanides, in other words, metformin, which we found decreases gluconeogenesis, or glycogen breakdown by the liver. In other words, it decreases the increase in blood glucose that's caused by the liver. It has other effects which we mention in other videos, but that's one of the items. You've got the basic simple oral anti-diabetic drugs like metformin. Insulin has been a mainstay. It's injected for the most part. They do have some insulin that you can inhale now, believe it or not. But we've never really had that much of a way to impact the other two major hormones that impact blood glucose. For example, what treatments do we have that impact glucagon? You could say, well, metformin impacts glucagon function. Well, okay, but that's it. In other words, there are a couple of major research efforts going on impacting glucagon. But here's where Ghrelin comes in. This group at UT and some other groups have basically developed mice models where, actually they didn't develop them, they've been around for a long time. You take a streptokinase type of chemical, you knock out beta cell function among mice. So therefore you've got a diabetic mouse. The blood glucose in this diabetic mouse goes way up because they can no longer drop that blood glucose. And guess what's happening? Yeah, glucagon is still working. So that's why the blood glucose level continues to go up in those mice. They've also now found a way to knock out glucagon receptors. In other words, knock out glucagon function. Well, when they knock out glucagon function, they're still getting a significant increase in blood sugar. And what they have found is that's due to Ghrelin. So this team in UT actually was able to block out not only the glucagon, but also Ghrelin receptors, and they cause huge decrease in mouse glucose level. So again, future treatments for diabetes may have a lot to do with the hunger hormone and blocking it, Ghrelin. It may also have to do with some of the other hormones as well, like glucagon.